Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the medial longitudinal fasciculus, also called MLF. What is medial longitudinal fasciculus? The MLF is a bundle of nerve fibers found in the floor of the fourth ventricle. This is the fourth ventricle. This is the floor of the fourth ventricle on either side of the midline. So here is the medial longitudinal fasciculus. It is located here. Okay, so it is posterior to the medial lemniscus. So this is the medial lemniscus. It is posterior to that, and it is anterior to the hypoglossal nucleus. This is hypoglossal nucleus. This is another hypoglossal nucleus. So this is the medial longitudinal fasciculus. Okay, so what is the purpose of this? What it does? Uh, it connects the third, fourth, sixth, and eighth cranial nerve. Third nerve, that is the oculomotor nerve. The fourth cranial nerve, the trochlear nerve. Sixth cranial nerve, the abducent nerve, and the vestibular part of the vestibulocochlear nerve, or the eighth cranial nerve. So this is a bundle of nerve fiber which connects multiple cranial nerves, and this third, fourth, sixth nerve that are essential for the movement of the extraocular muscle. Eighth cranial nerve is also essential for the balance of the eyeball so that it can maintains the eyeball in exact position. Okay, so with the disruption of the eighth cranial nerve, we may get nystagma or involuntary oscillatory movement of the eyeball that is possible. Okay, so we got that. Now we go to the next slide. Medial longitudinal fasciculus, also called internuclear ophthalmoplegia. So it's because these are the bundles of nerve fiber which connects the cranial nerve nucleus, third, fourth, sixth, and the eighth cranial nerve. So what happens is there is a lesion of the medial longitudinal fasciculus. The medial rectus perishes on the affected lateral gaze. So when a person have a lateral gaze, okay, so the two eyes should go in the same direction. But what happens if there is a medial longitudinal fasciculus of one side, then the medial rectus, it cannot move the eyeball towards the nose. The other side, the action of the lateral rectus, eyeball will move laterally. Okay, and there will be horizontal nystagma of the abducting eye that will happen. But we must remember that in medial longitudinal fasciculus, the convergence of the two eye is intact. That is very important for diagnosis. So, what are the causes of medial longitudinal fasciculus? Most common cause is demyelinating disease of the central nervous system. There is multiple sclerosis, that is the demyelinating disease of the central nervous system. But medial longitudinal fasciculus may happen in case of any type of stroke, vascular problem in the brainstem, or in some type of glioma of the brainstem. That may also lead to medial longitudinal fasciculus syndrome. Okay, so it may be unilateral, it may be bilateral, and fiber goes down through the medial longitudinal fasciculus. So bilateral medial longitudinal fasciculus syndrome plus a unilateral lesion of the abducent nerve, which is a sixth cranial nerve, forms 1.5 syndrome. In that condition, only the intact lateral rectus muscle will work. Okay, so lateral rectus muscle AB duct the eyeball. Okay, so we got that. So only the intact lateral rectus muscle will work there. Okay, so this is the medial longitudinal fascicular syndrome. Okay, so if we go there, Okay, here this is baseline. Okay, a person is moving, is looking forward. Both eye is going. Here lateral rectus is working here. Here medial rectus is working. This person has intact medial longitudinal fasciculus. Okay, here the syndrome is there, medial longitudinal fascicular syndrome. So this person is looking towards the left gaze. The right eyeball does not move medially because the paresis of the medial rectus muscle here. Okay, so the medial longitudinal fasciculus is the problem here, connecting this side. Okay, the right side here. Okay, it may be bilateral. Okay, we got that. Here our medial longitudinal fasciculus connects the cranial nerves like that of the, here is the vestibular nerve that is present, that begins from the internal ear. Okay. Then we have the abducens nervosus cranial nerve which innervates the lateral rectus muscle. We have the medial rectus that is getting innervation from the oculomotor nerve or third nerve. Okay. So there will be in coordination between the extraocular muscle due to disconnection of the fasciculus between the nuclei of the some of the cranial nerves. Okay, we got that. Now, okay, we got that, and that's all about the medial longitudinal fascicular syndrome and 1.5 syndrome. And these are my references. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me, and have a nice day. Bye now.